Meanwhile, the new blood sample study suggests that around 1% of people in Ontario have been exposed to COVID-19. It's a small fraction of the population, but it's still much higher than official case counts. And as Lauren Pelly explains, experts are warning that most people are still at risk of catching the virus.
A new analysis from Public Health Ontario looked at blood test samples provided by people across the province. Unlike swab tests, which show if you're currently fighting the virus, this approach can reveal if you've previously been infected.
These are called seroepidemiologic studies, which are measuring the presence of antibodies from the virus, which indicates that somebody had been infected with the SARS-CoV-2 virus.
A batch of blood samples analyzed in June found 1.1% of people had likely been infected. That would equal roughly 1 in every 100 Ontarians, or around 160,000 people to date. That's more than 4 times the official case count of close to 40,000 people who've had COVID-19.
It's still a very small population within Ontario that's been exposed.
The population remains highly susceptible.
Experts warn while more people had COVID-19 than we knew about, it's not clear how long their immunity will last. And most residents still remain at risk of catching the virus. But the good news, months of hard work paid off in keeping cases fairly low.
Distancing works, mask wearing works, the lockdown worked, keeping some businesses closed worked.
So it shouldn't change anything in terms of our behavior.
Those words of caution come as students are gearing up for a new school year and as more businesses keep reopening. So what can you do to personally avoid catching COVID-19? Well, the same rules still apply. Avoid large gatherings, keep your distance from other people as much as possible, and wear a mask. Lauren Pelly, CBC News, Toronto.